Whooping cough, also known as ptosis, is a highly contagious respiratory disease caused by the bacterium Bordetella pertussis. It is characterized by severe coughing fits that can make breathing difficult, often leading to a distinctive whooping sound when inhaling after a coughing episode. Whooping cough primarily affects infants and young children but can also occur in adolescents and adults, particularly those who have not been vaccinated or whose immunity has waned over time. Causes of whooping cough. Whooping cough is caused by Bordetella pertussis, the bacterium that infects the upper respiratory tract. The bacteria release toxins that damage a lining of the airways, leading to inflammation and irritation. The infection spreads through respiratory droplets when an infected person coughs, sneezes, or talks. Symptoms of whooping cough. The symptoms of whooping cough typically develop 5 to 10 days after exposure, though they can appear anywhere from 4 to 21 days. The disease progresses in stages. 1. Catarrhal stage 1 to 2 weeks. This is the initial stage and often resembles the common cold. Runny nose, sneezing, mild cough, low-grade fever, fatigue. At this stage, the disease is highly contagious, but the symptoms are often mild and can be mistaken for other upper respiratory infections. 2. Paroxysmal stage 2 to 4 weeks. The hallmark of whooping cough. This stage is characterized by intense coughing fits. Severe coughing. The cough occurs in rapid bursts or paroxysms and can be followed by a high-pitched hoot sound when inhaling. Coughing fits. These fits are often so severe that they may cause difficulty breathing, vomiting, or exhaustion. Post-cough vomiting. Vomiting may occur after coughing fits due to the intense coughing. The hoot sound is more common in children but can be less noticeable in older children and adults. 3. Convalescent stage 3 to 6 weeks or longer. This is the recovery phase where the coughing episodes gradually lessen in frequency and severity. The coughing fits become less frequent and eventually subside. The person may still cough occasionally for several weeks or months. Complications of whooping cough. While whooping cough can be mild in older children and adults, it can be dangerous, especially in infants and young children. Some of the complications include pneumonia, a common complication, particularly in young children, which can be life-threatening. Seizures, caused by a lack of oxygen during severe coughing fits. Brain damage. In rare cases, prolonged coughing fits may cause brain damage due to oxygen deprivation. Ear infections. Frequent ear infections may occur as a result of the bacterial infection. Dehydration. Severe coughing can cause difficulty eating and drinking, leading to dehydration. Rib fractures. Intense coughing fits can sometimes cause rib fractures in children and adults. Secondary infections. The inflammation and damage caused by the bacteria can leave the respiratory system more vulnerable to other infections. Diagnosis of whooping cough. Whooping cough is diagnosed based on the person's symptoms, history of exposure, and laboratory tests. Common diagnostic methods include polymerase chain reaction (PCR). This test is the most common and involves taking the sample from the back of the throat or nasal passage to detect the bacteria's DNA. Culture. The sample from the throat may be cultured to grow and identify the bacteria. Blood tests. Elevated white blood cell count can indicate an infection, though this is not specific to whooping cough. Serological tests. These tests detect antibodies to Bordetella pertussis in the blood. Treatment of whooping cough. While antibiotics are effective in treating whooping cough, they are most effective when started early in the course of the disease, ideally during the catarrhal stage. Treatment options include antibiotics. Azithromycin, clarithromycin, or erythromycin are commonly used antibiotics to treat whooping cough. Antibiotics help reduce the severity of symptoms and prevent the spread of the infection to others. However, they are less effective once the person has entered the paroxysmal stage. Supportive care. Hydration. Ensuring the person stays hydrated, particularly if they are vomiting frequently. Cough management. medications to manage coughing and promote rest. Oxygen therapy. For severe cases, particularly in infants, supplemental oxygen may be required. Hospitalization. In severe cases, especially for infants and young children, hospitalization may be necessary to manage complications like pneumonia or dehydration. Vaccination. Vaccination is the most effective method for preventing whooping cough. The DTaP vaccine, diphtheria, tetanus, and pertussis is administered to children in a series of shots starting at 2 months of age, with boosters given at 4, 6, and 18 months, and again at 4 to 6 years. Tdap vaccine, a combination vaccine for tetanus, diphtheria, and pertussis, is recommended for adolescents around age 11 to 12 and adults, particularly pregnant women, to protect themselves and newborns from whooping cough. Prevention of whooping cough. The most effective way to prevent whooping cough is through vaccination. However, the following measures can also reduce the spread of the disease. Vaccination. Ensure children and adults receive their full vaccination schedule, including DTaP and Tdap vaccines. Boosters. Adolescents and adults should receive the Tdap booster, especially if they are in contact with infants. Good hygiene. Encourage frequent hand washing, covering coughs and sneezes, and staying home when sick to prevent the spread of the disease. Isolation. People with whooping cough should avoid contact with others, particularly infants and those with weakened immune systems, until they are no longer contagious, usually after 5 days of antibiotics. When to see a doctor. It is important to see a healthcare provider if you or your child shows symptoms of whooping cough, especially if the cough becomes severe and persistent. The whooping sound is heard after coughing fits, difficulty breathing, vomiting, or a high fever develops. If you suspect your infant or young child has whooping cough, they should be seen immediately, as they are at greater risk of complications. Conclusion. Whooping cough is a serious but preventable disease, especially dangerous for infants and young children. It can be effectively treated with antibiotics, particularly when diagnosed early. Vaccination remains the best way to prevent the disease, and ensuring both children and adults stay up to date on their vaccines is key to protecting public health. Early recognition of symptoms and proper treatment can help reduce complications and speed recovery.